The rise in cases was observed in the last quarter of 2024 in Bolivia, Brazil, Colombia, Guyana, and Peru, with approximately 50% of the reported cases resulting in fatalities. In the first 4 epidemiological weeks of 2025, Brazil, Colombia, and Peru reported a total of 17 confirmed human cases, including 7 deaths. The overall risk of yellow fever outbreaks in the Americas has been classified as high, prompting recommendations to enhance surveillance activities, early diagnosis, and timely isolation and treatment. Yellow fever is caused by a virus primarily transmitted to humans through the bite of infected mosquitoes, particularly the Aedes aegypti mosquito, which is also responsible for spreading dengue, Zika, and chikungunya viruses. National epidemiologist Dr. Michel Francois shared additional observations made by the Pan American Health Organization regarding the disease.
In addition to the increased incidence, the Pan American Health Organization also noted a change in the geographic distribution of the disease, with spread to areas that were previously deemed as low risk. The most recent rapid risk assessment conducted by PAHO was aimed at assessing the potential threat of the increased yellow fever cases to public health in the region. It considered criteria such as the potential risk to human health, risk of dissemination, and the capacity to detect and respond within endemic countries.
The incubation period for yellow fever, defined as the time from infection until the onset of illness, ranges from 3 to 6 days. Similar to dengue, the initial symptoms of yellow fever include a sudden onset of fever, chills, headache, body aches, nausea, and vomiting. While many individuals may be asymptomatic or experience a mild form of the disease, others may progress to a more severe form characterized by high fever, bleeding, jaundice, yellowing of the skin or eyes, and potential organ failure. Dr. Francois emphasized that there is no specific treatment for yellow fever and management focuses on alleviating symptoms. Pain relievers and fever-reducing medications may be administered, but caution is advised against using aspirin and non-steroidal anti-inflammatory drugs (NSAIDs) such as ibuprofen and naproxen due to the increased risk of bleeding.
If you are traveling to a country where yellow fever is endemic, preventative measures such as the use of mosquito repellent, wearing protective clothing, and avoiding being bitten by the mosquito during dusk and dawn, which are the peak biting hours for the mosquito, may reduce your risk of getting yellow fever.
She highlighted that vaccination remains one of the most effective measures for controlling and preventing yellow fever.
The yellow fever vaccine is available in St. Lucia at the Leclerc and Vieux-Fort Wellness Centers, and if taken at least 10 days before the date of travel to an endemic country, will provide effective immunity against this disease. Since one vial contains sufficient quantity to vaccinate multiple persons, the public is encouraged to call their respective wellness centers to schedule an appointment. This will help to minimize wastage.
St. Lucia has not recorded a confirmed case of yellow fever in decades, and there are currently no suspected cases on the island. However, due to the presence of the Aedes aegypti mosquito, the potential for transmission exists if a returning national or visitor is infected. It is highly recommended that when planning travel, individuals remain aware of the risk of infectious diseases at the destination. By taking these precautions, you can protect yourself and help keep St. Lucia safe. The Ministry of Health, Wellness and Elderly Affairs will continue to provide updates as the situation evolves. Kayla Edwin, MBC Prime.